Osteoporosis is a skeletal condition that affects more than 200 million people worldwide and leads to a higher risk of bone fracture. Fractures can be life-threatening, especially for the elderly. One way to prevent fractures is to use drugs that increase bone density. A new type of medicine was recently developed to block the action of sclerostin, a protein involved in bone turnover. By blocking sclerostin, this new medicine increases bone density and lowers the risk of fractures. Some clinical trials of a sclerostin blocker called romosozumab suggest that taking this medicine may increase risk of cardiovascular complications such as heart attacks or strokes. The evidence from several trials of this medicine was, however, inconsistent, with some studies not showing this risk. Understanding whether treatment causes an increase in cardiovascular complications is important to establish, as this could lead to potential harm. In this study, we used two sources of evidence to try and better understand the relationship between these new drugs that block sclerostin and risk of heart disease and stroke. We first combined data from clinical trials and found that while there was a higher risk of heart disease among people treated with a sclerostin blocker, the evidence was not very strong. We next looked at data from human genetics for further information. The way in which people inherit their DNA means that it is possible to use DNA to reliably assess whether a drug causes disease. This can be thought of as a natural randomized trial. Some people inherit genetic variants that predispose them to lower sclerostin and higher bone density. We compared people who carry these genetic variants to those who don't as a way of conducting a natural experiment. We found that carriers of these genetic variants were at a lower risk of osteoporosis and fractures. In other words, our experiment showed we mimic the effect of sclerostin-blocking medicines on bone health. We then looked at whether carriers of these genetic variants were also at higher risk of cardiovascular complications. When we combined genetic data from hundreds of thousands of people, we found that individuals who carried these genetic variants were at a higher risk of heart attacks, and in addition to this, were at higher risk of other conditions such as diabetes and high blood pressure. These results support the findings from clinical trials and suggest that blocking sclerostin does indeed increase the risk of cardiovascular complications such as heart attacks. In summary, our study shows that while treatments that target sclerostin prevent fracture, they are likely to lead to a higher risk of heart disease. More information from patients treated with these drugs is needed. In the meantime, patients and their healthcare providers should jointly consider whether the benefits of fracture prevention outweigh the potential risk of heart disease.